Ask the Doctor by GPDQ.
Hi, it's Lucas, and I look after corporate healthcare at GPDQ. I have our clinical director on with us today, Dr. Kathrina Crystallis, and we are going to talk about lung cancer today.
Hi, Lucas. So this topic is particularly important to me as my dad is actually a lung cancer patient. So I fully understand on a personal level how important it is for people to get that early diagnosis and to be investigated early. So Public Health England and NHS England have actually got a campaign about this. So we wanted to mirror that campaign and raise awareness on the symptoms and try and tackle the barriers that people might be facing in terms of getting care and seeking the care and investigation that they need. So the reasons or the barriers that were identified were, firstly, people didn't want to go to the doctor because obviously during the pandemic they have realised how busy doctors are and they didn't want to waste the doctor's time. A second reason might be that they didn't want to be exposed to COVID by going and seeking help and catching COVID as an infection. And a third reason that was identified was that people confused with the symptoms of COVID. So the symptoms of lung cancer and the symptoms of a COVID infection are actually quite similar, and there's various crossover between the two illnesses.
Yeah. So, I mean, we sort of should know the symptoms of coronavirus to an extent, but what are the symptoms of lung cancer?
Thanks, Lucas. So the symptoms are a persistent cough for more than 3 weeks. Now, obviously, that's a persistent cough that at this present time is not associated with a COVID diagnosis. And you can see there's an obvious crossover with COVID because COVID, one of the main symptoms is a new cough. And especially with long COVID, it's, an extended cough, or it could be an extended cough over a period of time. So a persistent cough that's not associated with a COVID diagnosis. Coughing up blood is another symptom. An ache or a pain when breathing. Breathlessness that is persistent, or being persistently tired or lacking energy, and having unexplained weight loss. So those are the main symptoms, Lucas.
Wow. Okay. Right. Yeah. I mean, there are certainly some things to look out for that are different to an extent. So what should an individual do if they're experiencing symptoms? And I mean, people are sort of in that stage frame of mind that they are a little bit worried going to the doctor, their doctor. So they, as they don't want to catch COVID, so which is sort of a valid concern, or is it a valid concern?
Definitely. So it was one of the reasons that was identified that people didn't want to be exposed to COVID and going to their doctor. But if you are experiencing any of these symptoms, then do reach out and contact a medical professional. So if it's your NHS GP, if it's one of us as GPs, if it's your GP at your workplace, just contact and present your symptoms to a medical professional. And at that point, they will ask your symptoms and refer you for further investigations and examination. But it should be noted that we're a year into this pandemic at the moment, and at this point the levels of COVID in the community are fairly low, but also significant measures have been taken to stop the spread of COVID within the healthcare system. So at your GP practice, as much as possible will be done remotely to prevent you from being exposed. And if you do have to see a doctor, it's very safe. People wear masks, etc. And in the hospitals, there's COVID and non-COVID wards. So as much as possible has been done to take care of you safely. And the campaign by NHS England and Public Health England is actually called Help Us to Help You. Which is, really wanting you to come forward so that we can help you. And we just wanted to mirror that message here.
Yeah, thank you so much. And remember this week to put yourself and your health first.